We will now talk about the factors that play a role in maintenance of arches. In general, the factors helping in maintaining the various arches are as follows. The shape of the bones concerned. Intersegmental ties, staples or ligaments, and muscles that hold the different segments of the arch together. Tie beams or bowstrings that connect the two ends of the arch. And slings that keep the summit of the arch pulled up. In fact, to better understand the mechanism of arch support, let's take an example of stone bridge. The following engineering methods underlie the support of a stone bridge and help explain the methods used to support the arches of the feet. It can be divided up as such. Shape of stones. The most effective way of supporting the arch is to make the stones wedge-shaped, with the thin edge of the wedge laying inferiorly. This applies particularly to the important stone that occupies the center of the arch and is referred to as the keystone. Here you can see the shape of bones that are also wedge-shaped and support the arches of foot in similar fashion. One specific bone acts as a keystone in each arch. How are these stones held together? Interlocking the stones, or binding their lower edges together, is accomplished by metal staples. This method effectively counteracts the tendency of the lower edges of the stones to separate when the arch is weight-bearing. In the arches of the foot, this is done by ligaments and muscles present in the region. Next is the use of tie beams. A tie beam linking the ends of the bridge efficiently prevents the separation of the pillars and subsequent sagging of the arch when the span of the bridge is vast and the foundations at either end are unstable. In feet, the tendon of flexor hallucis longus acts as the tie beam to maintain the arch. Suspension bridge. The upkeep of the arch in this instance is dependent on a number of supports supporting it from a cable above the bridge's level. In the foot, this job is done by muscles such as the fibularis longus. So, that was just an example of similarity of arches of foot with that of engineering of a stone bridge. Let's look at the arches of feet under these headings. Starting with the shape of the bone. The transverse arch is formed and maintained mainly because of the fact that many of the tarsal bones involved, for example, the cuneiform bones and the bases of the metatarsal bones, are wedge-shaped, the apex of the wedge pointing downwards. The bony factor is not important in the case of the other arches. The keystone in the medial longitudinal arch is the rounded head of the talus. As for the lateral longitudinal arch, it is the cuboid bone. Next are the intersegmental ties. All arches are supported by the ligaments uniting the bones concerned. The most important of these are as follows. The spring ligament for the medial longitudinal arch. The long and short plantar ligaments for the lateral longitudinal arch. In the case of the transverse arches, the tarsal and metatarsal bones are held together by various ligaments and by the interosseous muscles also. If we look for tie beams-like structures in the foot, the longitudinal arches are prevented from flattening by plantar aponeurosis and by the muscles of the first layer of the sole. These structures keep the anterior and posterior ends of these arches pulled together. In the case of the transverse arch, the adductor hallucis acts as a tie beam. Lastly, we have the structure that work as slings. The summit of the medial longitudinal arch is pulled upwards by tendons, passing from the posterior compartment of the leg into the sole, i.e. tibialis posterior, flexor hallucis longus, and flexor digitorum. The summit of the lateral longitudinal arch is pulled upwards by the tendon of peroneus longus and peroneus brevis. The tendons of tibialis anterior and peroneus longus together form a sling which keeps the middle of the foot pulled upwards, thus supporting the longitudinal arches. The medial and lateral sole edges are drawn closer together when the peroneus longus tendon passes transversely over the sole, sustaining the transverse arches. The transverse arch is also supported by tibialis posterior, which grips many of the bones of the sole through its slips. That is all about the factors responsible for the maintenance of the arches of foot.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.